Hi, this is Michelle Peterson, and I am presenting my futures project on the healthcare in Pakistan and what does a future hold for them. The healthcare system in Pakistan is a three-tiered or three-level system. The primary healthcare is it's curative and preventative, and those are done in basic health units and rural health centers. The basic health units serve a catchment population of up to 25,000. The rural health centers serve a catchment population of up to 100,000 people. And so they're kind of the local medical facilities. The secondary healthcare system is the intermediate level of healthcare, and that is done in tehsil headquarters and district headquarters. So the tehsil headquarters serve a population of half to 1 million people, and those have on average 40 to 60 beds. Though the THQs, they provide basic and comprehensive emergency, obstetrics, and newborn care. The district headquarters are located at district levels, and they serve about 1 to 3 million populations. 1 to 3 million people. And then the DHQs, there they provide promotive, preventative, curative, diagnostics, and inpatient services. And then the tertiary is the far more specialized inpatient care units. Healthcare in Pakistan, an overall picture of it, there is no consolidated system of health insurance like the US. The public sector does not provide free medical health care to everybody, which is what most people think, that everyone has access to free medical care, and that's not the case. The U.S. spends 8.3% of their GDP on healthcare, and Pakistan only spends 0.42%. Around 78% of population for healthcare is paid for out of pocket in Pakistan. The private sector does provide 3/4 of the health services, and then the state comes in and picks up the remaining tab. In 2017, the Prime Minister launched a health insurance scheme to provide healthcare coverage to families earning $2 a day or less. And I think that's a big reason why people don't go to the doctor there. Not only is it not very accessible, but a lot of them just can't pay for it. To earn less than $2 a day is just crazy to me. Some of the most common diseases and conditions in Pakistan, dengue is one of the biggest, and that is a virus caused by a bite of an infected mosquito. Congo virus, malaria, typhoid, measles, HIV, AIDS, rabies. One of the biggest problems there is malnutrition or lack of basic health facilities. And in the next slide, we'll watch a clip of a video that talks a little bit more about the malnutrition, specifically in children.
Over 40% of children actually under 5 are stunted. We have a situation of almost 20% underweight and 15% wasted. It is definitely a wake-up call that there is a silent emergency in the country, and it needs urgent attention from all concerned.
The other girls sharing Zakia's bed also died. Most children here are killed by preventable diseases because their malnourished bodies are too weak to fight them. Malnourishment here is a multifaceted issue. Even the mothers are either malnourished or have stunted growth. They have children every year, and because they're so poor, they can't provide proper nutrition for their children.
As we saw in that clip, the medical facilities are very primitive. They're very basic, and they don't have a lot of modern technology, and they look like they could be a little bit more sterile. But here are some of the challenges in Pakistan's health system. As you can see, there are a lot of them, and this is not all of them. One of the things you'll notice is that corruption is on here, as we've studied all through this semester. That is just a glaring problem in Pakistan, is just the sheer amount of corruption everywhere. The future of Pakistan, just a few suggestions and thoughts. Decentralization and delegation of policymaking to districts. It makes more sense for the policymaking to be sent out to the local areas where they are on the ground. They're working with the people and they know what the needs are, instead of making those decisions in a higher government where they're not aware of what's going on. Access to doctors and medical advice via internet and phone. There was a projection that 50% of the population of Pakistan would have cell phones by 2020. And if that's the case, then if you don't have a cell phone, chances are you know someone who does. And if you needed medical advice, it'd be easily accessible and cheaper through the phone. Better access to family planning and birth control options. There are a lot of poor families that have lots and lots of kids. If they had easier access to birth control, I think it would help immensely. If they're making $2 or less a day, chances are they're not going to have money for those options. And then education, we know that that affects everything. The literacy level is so low there, and not only would it help with being able to get a better job, but it also helps with awareness, knowing what diseases you can avoid and how to avoid them, and just being aware of your surroundings with education. Why should I care? Just a few thoughts. Healthcare is a fundamental human right. Just on an empathetic level, the WHO, I put the definition of a fundamental human right, and healthcare is listed there. Also, there's a less chance of populating madrasas. A couple weeks ago, we did watch those videos in the Digging Deepers about madrasas and how the recruiters kind of focus on the families that are very poor and have lots of kids, because they wouldn't be able to get their kids out, and they can't afford to feed all of them. And I feel like if we could have a little bit more control on those populations, then maybe we wouldn't have as many. And that does affect us in that there would be less terror attacks, possibly. The other thing I thought is that Pakistan has had a rough beginning, and they just need help. And I think that giving them a chance for better healthcare would help them in a lot of ways, and not just making them healthy, but helping them be more successful in other ways. And here are my references. Thank you.